Okay, so today we're talking about working with clients who may have hypertension or high blood pressure. So normally the main goal for these clients would be weight loss. We just have to find a safe way to achieve this, because when they lose weight, generally the blood pressure will drop. So ask the client always to listen to their body. How they feel should dictate the frequency of the exercise, and we want to make sure that any exercise that we're doing is not high intensity and isn't taxing on the body. So for these clients, frequency is more important than intensity. So trying for 3 to 4 times a week. We need to make sure that the blood pressure is under control before we start any exercise program. So we really need to probably liaise with a doctor and ask the clients to do a thorough pre-exercise screening, and just ask if they're taking any medication. So for some clients, just starting with 10 to 20 minutes of low intensity cardio like walking would be perfect 3 or 4 times a week. They can try out walking, swimming, biking, generally on the stationary bike. But we must make sure that these clients warm up and cool down properly as well. We can also try and introduce some strength training. We just have to be sensible about it. And we don't want to put the client under high stress by lifting, really heavy weights. So we aim for lighter weights. So higher number of reps with good form is what we're looking for. So between like 12 to 15 reps with a lighter weight. We need to instruct the client to breathe properly, to use proper breathing techniques so that they're not holding their breath, because holding the breath will probably push up the blood pressure even more. We don't want to lift maximum weights. We want to be careful and be aware that certain medications will affect a person's heart rate. So using a heart rate monitor might not be the best way to monitor a person's heart rate with high blood pressure. So we can use rate of perceived exertion or the talk test to measure exercise intensity. So the main goal for these clients would be to get that blood pressure down, to get the weight back into a more healthy range. We need to also probably liaise with not only a doctor but also possibly a dietitian or a nutritionist who could help the client to improve their diet, because we want to make sure that we're taking a holistic approach and not just looking at exercise. A healthy diet will also help to bring down that weight and have a much healthier lifestyle. We also have to make sure that these clients are drinking enough water, especially during exercise. And if there's any signs of dizziness or they're just not feeling right, then we need to stop exercising and have a talk to the doctor and the client about what's going on. So we always want to consult with the doctor before starting an exercise program. So that was high blood pressure. I'm now going to talk about lower back pain. This is a really common condition, especially for clients who are sedentary and who are sitting a lot of the day behind a desk and probably not using their core muscles to support their back. If the pain is really bad, we need to look at referring to a physio, and also having a look at the physio's program and our own program for these clients and trying to collaborate and work together. We could also screen the client's posture and movement patterns thoroughly, just to make sure that these things are not contributing to back pain. We need to look at some trunk strengthening exercises and aim for safe and effective movement. Normally, trunk flexion to rotation movements are the cause of back pain injuries. We need to ensure that all exercises that we choose are safe, and make sure that clients earn the right to move up to a heavier weight and more complex movements depending on how their back's going and their range of motion. We need to look at really strengthening the posterior chain for them, so the muscles in the lower back also the glutes, hamstrings. We need to also look at strengthening the core by doing some plank exercises, anything that's going to help improve that lower back pain. And we need to develop the muscles that are going to support the lower back. We also need to make sure that these clients are stretching properly and using lower back exercises like good mornings, introducing dynamic stabilization exercises. We could use an exercise ball. We could also collaborate with the physio. We could look at using that exercise ball to do squats and any other exercises that might be too hard and taxing on the back when it's feeling sore without the support of an exercise ball. And we need to strengthen the secondary muscles of the spine. But the most important thing would be liaising with the physiotherapist to make sure that we're all on the right track and the same page with these clients. Next thing I'm going to talk about briefly is knee pain. Knee pain could be caused for older clients by arthritis and also by possibly carrying too much weight. So we need to look at the client's weight to see whether the client is overweight and that is putting extra stress on the knees. And we also need to talk to the client about the previous kind of exercises that they were doing. Like if they've been a fast bowler and they've put excess strain on that knee for years and years and years, then that's probably another reason for the pain. So sometimes for these clients, it's difficult for them to exercise because they are in a lot of pain, and the excess weight and the strain that they've put on their bodies is causing that. So it says every 5 kilos a person is over their BMI adds 36% risk of osteoarthritis, which is kind of crazy, but makes a lot of sense. So it's hard to find exercises where a person with bad knees is not going to hurt themselves, so we need to recommend that the client visits a physiotherapist. Walking might be the best exercise to start with first. We don't want to be doing anything too high impact. We also need to maybe recommend swimming because the water will take the extra weight and the load off the joints. So we need to be looking at low intensity exercises that won't place as much stress on the joints. We need to avoid traditional squats and lunges, which are just going to put far too much pressure on those joints. We need to maybe try high wall squats. We also need to probably do a thorough posture analysis, look at the alignment of the knees, make sure there's not excess pressure going onto those knees because of poor posture. So low intensity, getting them to look at their weight and see if that needs to be improved, possibly referring to a nutritionist as well. So they can still do strength training. We just have to make sure that we're not doing any high intensity circuits that's going to involve a lot of jumping and quick hard movements. And that's all for me from now. Thank you.